Pregnancy cravings are real. One minute you want a big bowl of fufu, the next you are dreaming of iced coffee. But wait, what if some of these cravings can actually be dangerous for your baby? Many people assume that if it's sold in stores, then it must be safe, but that's not always true. Some foods and medications that seem harmless could actually increase your risk of miscarriage, birth defects, or complications during labor. And trust me, you don't want to take that risk. So now let's talk about 9 foods and medications you must avoid during pregnancy. And don't worry, I'll provide you with safer alternatives so that you don't end up starving or suffering in silence. Firstly, we have high mercury fish, that is tuna, shark, mackerel, and swordfish. Fish is healthy, right? Well, not all fish are pregnancy friendly. Some fish, especially the big ones, have high mercury levels, which can affect your baby's developing brain. Studies show that babies exposed to high mercury levels during pregnancy score lower on memory and coordination tests later in life. That sounds scary, right? Instead, go for low mercury options like salmon, shrimp, or sardines. Your baby gets the benefits of omega 3s without the risk. Secondly, raw or uncooked meat or eggs. Medium rare meat might sound delicious, but it's not your best friend during pregnancy. Undercooked meat and egg can carry bacteria like salmonella and toxoplasmosis, which can cause food poisoning. And trust me, that's the last thing you need while pregnant. The CDC, that's the Center for Disease Control, reports that pregnant women are 10 times more likely to get a listeria infection, which can lead to miscarriage. The rule: cook everything fully before eating. No runny eggs, no pink meat, and your baby will thank you. Thirdly, we have unpasteurized dairy and juices. You might think fresh raw milk is healthier, but during pregnancy, it's a hard no. Unpasteurized dairy and juices can contain listeria, a bacteria that can cross the placenta and harm your unborn baby. Listeria infections in pregnancy can increase the risk of stillbirth by 20%. Instead, stick to pasteurized dairy and juices. Same nutrients, but way safer. For number 4, we have too much caffeine. I know. Mornings without coffee sound like a nightmare, but too much caffeine can actually increase the risk of miscarriage and low birth weight. 200 milligrams of caffeine, that is around 2 cups of coffee, can cause harm to fetal heart development. If you need caffeine, limit it to 1 small cup per day or try decaffeinated coffee and your baby will thank you. For number 5, we have alcohol. A little wine won't hurt, right? Wrong. Even small amounts of alcohol can lead to fetal alcohol syndrome, which can cause lifelong developmental issues for your child. The safest option, just skip it. There are amazing non-alcoholic drinks out there that still make you feel fancy. For number 6, we have processed meat, that is hot dogs, deli meat, and sausages. Ever heard of listeria? It loves deli meat. Pregnant women who eat contaminated deli meat are 20 times more likely to get listeriosis. It sounds scary, right? Yes. And it can also cause miscarriage. If you really want to eat that sandwich with that meat, make sure to really heat the meat until it is steaming before you eat it. For number 7, we have painkillers like ibuprofen, diclofenac, and aspirin. Do you have a headache? Be careful what you grab. NSAIDs, that is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and aspirin can increase the risk of miscarriage by 80% in the first trimester. As a safer alternative, stick to paracetamol or acetaminophen for pain relief, but always ask your doctor first. For number 8, we have herbal supplements and tea. Not all natural things are safe during pregnancy. Some herbs like ginseng, aloe vera, and leucorrhized roots can cause contractions or mess with hormonal levels, increasing the risk of preterm labor. Safe options: ginger or peppermint tea, which can also help with nausea. And last but definitely not the least, on number 9, we have recreational or over-the-counter medications like Red 225 or Tramadol. Now let's talk about something serious: drug abuse during pregnancy. A 2023 report showed a 45% increase in pregnant women abusing tramadol, which can lead to premature birth, stillbirth, and birth defects. The latest trend, Red 225, a dangerous opioid-based drug that has become popular on social media such as TikTok. This drug causes addiction, severe withdrawal syndromes in newborns, and in some cases, even death. The bottom line: never take any drug during pregnancy unless prescribed by a physician. Your baby's health is definitely worth it. Finally, let's take this test from Jeremiah chapter 29, verse 11. It says, "For I know the plans that I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you a hope and a future." Every pregnancy is unique, but one thing is true: God has a beautiful plan for both you and your baby. Pregnancy is an amazing journey, but what you eat and take matters. These small choices have a big impact on your baby's future health. Stay safe, stay healthy, and trust the journey. If you found this video helpful, don't forget to like, share, and subscribe. This is Better Health with Dr. Payne. Remember, better health starts here. For more information on the uses of paracetamol and diclofenac and when not to use them, click on this video. Yeah, that's one.